As the pandemic sweeps through India, many health experts predict that Nigeria will become the next prey for COVID-19 because of its many similarities. With over 200 million inhabitants, Nigeria is the most populous country in the West Africa and the seventh most populous country in the world. Nigeria has so far reported 1,600 deaths from COVID-19, compared with nearly 600,000 in the US. However, experts say this does not mean that COVID-19 is not looking to Nigeria and other African countries, but that it is just a not coming yet nightmare. Nigeria is really vulnerable. This country has a lot in common with India, said Ngozi Irandui, senior researcher at the Center for Global Health Security at the Chatham Institute in the UK. Before suffering the second COVID-19 wave, India was considered quite fortunate to have escaped the worst scenario of the first outbreak, despite having many crowded cities, limited public health measures, and patchwork of the healthcare system. The country only reported 160,000 deaths as of November 2020, equivalent to a rate of 11 deaths per 100,000 population. But in April, a new infectious strain, B1617, appeared and spread across the country, causing an exponential increase in morbidity and mortality. Up to now, the South Asian country has recorded more than 250,000 deaths. The death rates increased to 18 over 100,000 population. David X, editor of the Daily Beast, says nCoV is an opportunist, always hunting for crowded and unprotected communities. nCoV has the ability to mutate every 2 weeks if it continues to spread on a large scale, to create a new variable that spreads more quickly and easily. The tragedy of India is a testament to this. The second major outbreak is believed to have originated in crowded religious festivals with many people not wearing masks, and less than 3% of the India's population is fully vaccinated. Nigeria, a country with many densely populated cities, is also a poor country with a poor health system, relatively similar to India. However, the country's situation in West Africa is even more ominous, as it doesn't have vaccine production facilities like India, and all vaccines have to be imported. To date, less than 1% of the Nigerian population has received at least one dose, and almost no one has received the full two. I see COVID-19 fires that are raging around the world in the coming weeks and months, and I'm most concerned about Africa, said Lawrence Gostin, a global health expert in the University Georgetown, said. I see the crisis in India as the leading sign of what's to come in low and middle-income countries. Lagos expects to receive 84 million doses of vaccine from AstraZeneca and Johnson & Johnson in the coming weeks, but this vaccine is only enough for 1/5 of the Nigerian population to complete the vaccination program. To inject 3/4 of the population, the rate experts say can achieve public immunity, Nigeria is expected to wait until 2022. According to commentator X, the world can prevent the COVID-19 tragedy from recurring in Nigeria by a fairer global vaccine distribution that can create a firewall against outbreaks in this West African nation, as well as other less developed countries. However, this will require the rich countries of the world to stop hoarding excess vaccine stocks and share resources with the poorer countries. Global supply is not the biggest problem. The US, a country with a lot of vaccine makers, has more than 60 million unused doses. A few weeks after the surge in COVID-19 cases in India, the administration of President Joe Biden promised to deliver some of the AstraZeneca preventive vaccines, which have not yet been licensed for use in the United States, to the South Asian country. Earlier last year, the World Health Organization (WHO) and a number of partners created a COVAX program, encouraging rich countries to share vaccines with poor countries. COVAX's goal is to deliver 100 million doses of vaccine to poor countries by March, but in fact, less than 40 million doses have already been shipped. This has caused Nigeria and many other countries to fail to vaccinate, says researcher Arandui. America is also part of the problem. The administration of the former President Donald Trump has refused to join COVAX. Only in February, after taking office, the Biden government reversed its decision. The White House pledged to support $4 billion in cash, making the US the largest donor of the COVAX. At the same time, Biden also declared in favor of giving intellectual property rights on vaccines, creating conditions for countries to increase production. However, many experts are skeptical that the result of ditching intellectual property rights could have increased the availability of vaccines for countries that need it. Meanwhile, many other rich countries have also been slow to fulfill their commitments to COVAX, making the situation even more difficult, and many poor countries unable to implement vaccination programs because there are no vaccines. According to X, if it gets more supplies of the vaccine, Nigeria can avoid the risk of becoming the second India. What is missing is that countries that have a vaccine surplus don't appreciate the importance of sharing it, the editor said. The video is over here. If you see it is a good video, don't forget to like, subscribe and leave a comment below. Thank you for watching.